with Amare. That's my favorite thing to do now. So today we are talking about garments. I'm going to do tons of videos on this because this is something that makes me so agitated. Guys, what is going on in the Faja world? What in the Faja, guys? Oh my God. All right, so let's start with this. I did a video on waist trainers, right? And why we don't use waist trainers after surgery, because they're not a post-surgical medical grade compression garment. I need you to understand something. The word faja does not mean post-surgery garment. The word faja is something you wear under a dress, right? So in the Colombian and Spanish culture, your faja is a girdle, is a dress, like something to go under a dress to hold your fat in. They have started being used for post-surgery compression. This is where the problem comes in. There's a very big difference. When you have lymphedema, which is the chronic swelling condition where you don't have any lymph nodes and your body has chronic swelling, similar, extremely similar to the same, and actually exactly the same as the swelling you have post-surgery, where you're blown up. People live with that 24/7. They get a compression garment. They get a compression sleeve, they get a glove, it's surgically fitted to them. So they actually measure, and I'm a certified lymphedema fitter. So they measure from where your swelling is all the way up the whole limb for medical grade compression. The compression is graded. So what that means is it's not just tight all the way around. It's not squeezing the shit out of you all the way around. It is graded compression. So it's tighter on the bottom, looser on the top to get the lymph fluid or the swelling that's leaked out underneath your skin that's now swollen and puffy back into your lymph system. It is specifically measured and designed for proper compression. Now, there are different grades of compression. There's 10 to 20, 20 to 30, or I think it's 10 to 15, 15 to 20, 20 to 30. And so on and so forth. It can go more, but they usually don't do that because that's crazy. And that's based on the strength of the compression. So we got two components. We have the way it's cut and the strength of the compression is how a compression garment is supposed to be designed for medical grade compression. Guys, you are having a medical surgery. You need medical grade compression. Okay, so what is the point of a compression garment? It is not to get your swelling to go down. It is not to get lymph fluid and swelling out of your body. That is not what a garment is meant for. A garment is meant to hold you at a proper ratio of compression to keep you from swelling or blowing up even more and to maintain where you're at. Again, I'm going to say it. A garment, a faja, is not meant to squeeze you to get your swelling down. That is not how that works. Your body is what processes out the swelling. Your lymphatic drainage massages dilate your body to get it to suck the swelling back so you pee it out as your body's supposed to normally function. Squeezing yourself into the tightest faja possible is not going to help your swelling. It is going to create fibrosis. So I'm doing multiple parts of these videos for each section because if I had to go through the whole thing about the compression garment problem, I would be talking for an hour and a half and no one wants to listen to me for that long. I know you don't. I know I'm Ashley with Amare, but I know nobody wants to hear that. So the point of this video is to explain to you why you need a faja or a compression garment, as it should be called, a medical grade compression garment for post-surgery. So it's meant to hold you at the compression ratio, the same comfortable level compression ratio, the entire recovery. It is not meant to get tighter and tighter and tighter and constantly squeeze the crap out of you. That is how you pass out. That is how you cause fibrosis. That is how you cause garment burn. That's how you destroy your incisions. That's how you wind up with seromas. Because you are squeezing that fluid. You're basically, picture your body as one big blister. You know you have a blister, right? It's a bubble and it's full of swelling. It's a blister. If you squeeze the crap out of that, certain parts of the blister are gonna pop. You're gonna damage tissue. You're gonna damage skin. That's not what we wanna do post-surgery. Your entire lipo 360 area, let's take something simple. Your entire lipo 360 area is one giant swollen big blister. We do not want to put a giant rubber band around that blister. We don't want to squeeze it into the tightest thing possible. Your garment should not be extremely uncomfortable. That's not how that works. A garment is meant to hold you, not squeeze you. Very big difference. So your garment should feel like a soft cast. It should feel supportive. It should hold you. It should hug you. You should be able to bend down and touch your toes in your garment. You should be able to fully stretch in your garment. You should be able to reach to the side in your garment. You should be able to move and breathe normally in your garment. If it is crushing your ribs, if you're getting stabbing pains, if it is pinching like crazy, if you're having all of these issues, there is a problem with your garment. And it's going to cause a ton of fibrosis, and it's going to cause a ton of fluid buildup and backup. You're going to wind up with pouches of fluid. You're going to wind up with pouches of fibrosis. You're going to wind up with really hard lumps on your sides by your ribs and on your lower abdomen. You're going to get that giant pelvic pooch. You're going to get that one big thick line of fibrosis where either the zipper is placed or the scar, the clips are, or where, if you even have those, because I know a lot of garments don't. But wherever that thing is crushing you, you're going to wind up with problems post-surgery. A garment is not meant to squeeze the living daylights out of you. No, it is meant to hold you comfortably. Number one. Number two, fajas. Guys, when you go get these fajas, and I'm going to do a whole video on custom fajas and why you need to be extremely careful. When you go to get these fajas, these are not medical people. They are not accounting for the surgery you had, the swelling you have, and where your results are going to be. They are not accounting for fibrosis, seromas, incisions. They are just putting you into something that fits you really tight. And that's it. They are not medical grade post-op certified compression fitters. They're not that. They're just people selling a faja. Even worse if you get it on Amazon, because you guys don't always measure right, and that's a whole nother issue. So please be careful with where you are getting your things. Now, I know I've been saying this for a while. We have our own medical grade post-op compression garments that I designed. If you guys need one, you have to set up a virtual with me because I have to measure you properly. We have to take into account your swelling, your surgery, BBL, fat transfer, tummy tuck, lipo. We have to put all of that together, and I have to measure and fit you properly for a garment. It's not just, oh, okay, I'm a small. Oh, okay, I'm a medium. Oh, okay, that's it. No. Garments are supposed to be cut for ratios of compression. Fajas are not always cut for ratios of compression. Fajas are just the name for something that usually goes under a dress that's meant to hold you and tuck everything in. So no, not all fajas are meant for post-surgery. That's not how that works. Can you use them? Can we rig them with the lipofoams to fit properly? Yes, but that takes a hell of a lot of work. And they can be really expensive. Now here's the thing, in Miami, they will take these Colombian fajas and mark them up to $170, $150, and tell you that you need a stage 2, 3, 4, and 5. Let me bring something to your attention. If you've had a BBL, how on earth are you going to squeeze into 4 sizes smaller without crushing your fat transfer? That is not okay. Because you are going to be in maybe a 1, maybe a 2, and that's it. Your fat transfer is not going to get smaller. It's not going to shrink. It's not supposed to. If you're putting too much pressure on that, you're going to destroy it. It's going to be small because you're trying to snatch your waist in this extremely tight garment, not taking into account the compression ratios for your BBL, the new ratios of your body, and you're squeezing the fat transfer in the back because you're trying to squeeze your waist because you think you need to be in the tightest thing humanly possible. No, that is not how that works at all. And there are the fajas that have just the sheer, stretchy material in the back that give you no compression over the fat transfer area. Or the worst that I've seen is just a giant hole cut out where your butt's literally hanging out. That's literally creating a ring of pressure on your fat transfer. There are so many things. I'm going to do a video for each individual things. What faja you need for a BBL. What to be careful with the custom fajas. Why you should never take in a faja. Do you know how expensive that is, number 1? Number 2, you know nothing and the tailor knows nothing about proper compression ratios for swelling and healing post-op. You're going to mess your body up and you're going to wind up with fibrosis, and it's not going to be the most comfortable thing in the world for you. And your recovery is going to take forever. Now, we're going to do videos on all that. But why you need a faja? Garments and fajas are meant to keep you at the same compression ratio the entire recovery. So when you are shrinking, you're not meant to squeeze your body into it to get yourself to shrink. When that becomes loose on that first set of hooks, then you go down to the smaller set of hooks. When that becomes really loose, then you go down to the smaller set of hooks. You are stepping down in your garment based on where your swelling in your body is at. You should not be squeezing yourself trying to get your swelling down. That is not how that works. So the reason you get different stages is because of how you're shrinking. You need your compression to be at the same exact comfortable compression ratio the whole healing. And as you're shrinking, you need something that's going to keep and maintain and shrink with you for that. You don't need to be squeezing yourself into a million different garments or flip-flopping garments in the middle of your surgery, getting a totally different cut of garment than the one that you had before. That's a huge no, because your body needs to be held in the same way. Again, you break your arm, you need a cast. You stay in that cast for 2 to 3 months. That cast is that cast, and that's it. That bone heals. Then you go down to like maybe a sling or like a soft cast. That's what you stay in until it heals. You're not going into 4, 5, 6, 7, 8, 9, 10 casts, and they're not cut in all different ways and squeezing you in all different ways. A cast doesn't squeeze your arm when it's broken. It holds you. A garment should hold you. It shouldn't squeeze living daylights out of you. It shouldn't be that uncomfortable. And if it is, we got a problem. So there's that. The biggest thing when you're getting a garment is, I know your doctor puts you in a garment after surgery. I get that. That garment you need to be in for the first couple days. After that, you need something that's going to hold you like a soft cast, not squeeze the crap out of you. As I just keep saying over and over, because I want you guys to get this in your head. That's not how that's supposed to work. I understand that's what everybody says. That is not, I'm telling you, medically, that is not how that is meant to work. For lymphedema patients, for patients with cancer, for all of those things, medical grade compression, that's not how that works. And in the post-surgery world, it's not how it works either. That's why we have so many problems with the garments and not knowing which ones to get. So you're going to be in whatever your doctor put you in out of surgery for the first couple days. Whether it's a binder, because you have drains, or an actual garment. Then you need something that you're going to be in for the next couple weeks. As your swelling comes down, the garment shrinks with you. And again, this is why stage 4, 5, 6, 7, 8, 9, and 10 and flip-flopping garments all over the place, that's not a thing. That's a Miami markup thing for them to make money. That's not how the body is designed to work medically. That's not how your swelling works medically. So if you've had 5 liters of just lipo, right? This is the only exception. If you've had 5 liters of lipo taken out 360, your body is going to shrink a lot. You're going to be very swollen to begin with. So yes, you're going to start in a bigger garment, and you're going to go down all 3 hooks, and it's going to be big, and you're still going to need to heal and need a garment. So now you're going to go into, let's say you were at a 2X. I actually had this happen to a client. She got 5 liters of lipo, the most that they'll take out of you in one session. And she was so swollen, like super swollen. She was in I think it was a 2X. So we started in a 2X. With her coming in consecutively for proper Vater-style manual lymphatic drainage, she shrunk down those 3 hooks, which is about an inch a hook. She shrunk down 3 inches in a week. So she needed now an extra large garment. Now, mind you, this is with the lipofoams in, our Amare lipofoams, not any kind of boards or any craziness. This is per our protocol. She dropped 3 inches. So we got her into an extra large. By the end of that week, it was huge on her, like this. Huge. So there's that. So then after that week, we got her into a large with the lipofoams. At the end of her large, she had no more swelling. She had no fibrosis. She was completely healed, tissue and everything, and was out of a garment. Done. No foams, no garment, no massages, completely finished. Because once we get that swelling out, why are you in a faja? What is the point? The point of a faja is to hold you so you don't blow up and to keep that same compression ratio until you heal. People saying they're in fajas for 3, 4, 5, 6, 8 months, a year after lipo because they still have swelling and fibrosis, your faja is trapping it in there. And you keep trapping it by squeezing the living daylights out of you and not getting any circulation to your lymphatic system. Nothing's processing out of your body because it's being trapped by the faja because it's a million sizes too tight. So again, with her situation, she needed 3 garments because she had 5 liters of lipo, and that was 9 inches off her waist. Each garment, our garments, not anybody else's, I'm talking specifically about our garments, are 3 inches in there that you shrink. She shrunk 9 inches. She had 5 liters of lipo. So this is why she needed 3 garments. But again, at that last one, done. She was completely healed from her lipo at the 6-week mark. Out of her garment, out of her foams, back to working out, incisions fully healed, no more swelling, no fibrosis, no seroma, nothing. Done. Completely healed, go out into the world and show off your new body. Because we had her in a proper garment. Because she wasn't being squeezed her healing wasn't being thrown backwards or trapped or frozen by the garment. And this is what's happening to you guys. And this is why you're so confused. So a garment is meant to hold you while you heal, not squeeze you, not for getting rid of swelling. A garment is meant to hold you so you don't swell up more. A garment is meant to hold you so you heal, and it's meant to shrink with you at the same exact ratio, not smaller and smaller and smaller. So there's that. With this whole thing about needing to wear your garment for a year, 2 years, because of all the swelling, this is because you're trapping it in there. A garment is only meant while you have swelling. If you come to me in a virtual 7 months post-op lipo, and you've been in a garment for 7 months, or at 3 months you stopped wearing your garment was too tight to begin with, you have massive swelling, complete fibrosis, and you're at 7 months and you tell me, yeah, but my doctor said after 3 months I don't need to wear a garment. That's only if you're healed. That's only if you have no swelling. That's only if you are done. If you are still swollen, if you have fibrosis, if we still need to be picking up where you left off with your post-op, like I said in one of my other videos, just because you're 7 months out doesn't mean your body is 7 months out in the process. Your body can still be 2 weeks in the process while you in your head had been 7 months from surgery, and you haven't done the work to get your body up to speed to that 7-month mark. You're not healed. You're still 2 weeks post-op, baby girl. Your body is still 2 weeks post-op. Just because you're 7 months out doesn't mean that's how that works. So when I tell you, you have to get back into your garment with the foams 24/7 until all of this is healed, and we need to actively work on this and take this seriously and be on top of it with your post-op care and really take care of everything now. And you're like, well, I don't want to because it's 7 months. All right, well, you're not going to get better, dude. Like, you guys have to be smart about this. You have to know why you're doing these things, because you can't just expect it to heal on its own. This is a major surgery. All of these things, lipo, BBL, tummy tuck, breast aug, fat transfer, mommy makeover, these are major surgeries, guys. We got to start treating this like a medical surgery. So, garment is not meant to squeeze fluid out of your body. Garment is not meant to get rid of swelling. Garment is meant to hold you while you're actively getting your massages to get rid of swelling. Garment is not meant to squeeze the crap out of you. Garment is not meant to be so tight that you can't breathe. Garment is not meant to be worn after you're completely healed. If you want to get out of your garment quickly, if you want to be done, with the exception of a fat transfer, which needs 6 to 8 weeks, I say 8 just because we're protective, but 6 weeks to heal. If after lipo, you want to be out of your garment, if you've been in your garment for 3 months and you're like, oh hell no, I can't take this shit anymore, but you're still swollen and you're still fibrotic and you're not healed, you need to get up on your post-op care. You need to set up a virtual with me because you're not doing something right and you're still swollen. So if you're trying to shorten the time that you're in your garment, like I said, 5 liters of lipo, a month and a half out. She came to me 48 hours after. A month and a half out, no garment, no foams, completely healed, done, out of the garment. You do not need to be wearing a garment after you are fully healed. The quicker you are healed, the more intense your recovery is, and the more serious you are taking your post-op care, the more proper MLD massages you are getting when you're on top of it at that mark. And people are always bewildered when I say this. At that point, when your body's healed, you're done. And when you guys come into my office and I'm working with you actively and we're really like getting this going and you're shrinking like 2 inches a day, like I mean like really, really, really shrinking, you are so on it and you listen to everything I say, and I tell you, yeah, you need to be on the 3rd hook, and you look at me like I'm freaking crazy. And I'm like, I can feel your body. I can feel where your swelling is. I can see. I don't even need to feel. I do it over virtuals all the time. I can see where your body is. You need to be on the 3rd hook. And you're like, what? There's no way. You go to put on the 3rd hook and you're like, holy shit, I didn't even know. Because you guys don't know. You have no clue. Because you don't know how this is supposed to look or feel or what it's supposed to be like. Even something as simple as a compression garment, you don't know. You have no idea. So for compression, it's meant to hold you. It's not meant to squeeze you. It's meant to be comfortable, but it's not meant to be worn for a year out. If you're still having swelling 6 months out and you're in a garment, if you're still having swelling 8 months out, a year out, and you're still wearing a garment because you have to, because if you don't, your body is going to swell like crazy. If you take off that garment at 8 months and you go to take a hot shower and you swell, dude, we have a problem. Dude, we got a real problem. because you're 8 months post-op. Your tissue is healed. If you're still swelling like that, it's crazy. It's crazy. Like you're still all that swelling is still 2 weeks post-op, never went anywhere because you got squeeze massage, because you did body contouring, because you did wood therapy and never treated your lymphatic system to get that swelling out of you. That's why you're still wearing a garment at 8 months. So that's not a normal thing. Is it common? Yes. Is it normal? No. Is it healthy? No. That's not how that works. So to end and sum up this rant, because there will be many more coming, and guys, I'm actually going to be doing with a couple professionals in the field as well as a couple clients of mine who are virtual with this whole garment problem. Really quick story. Lovely client of mine. I love her so much. She has become my best friend. And I see her once a week, and you know who you are, Missy. She had got a custom faja made, and we're going to show you this, and I'm going to post pictures of it. She got a custom faja made before surgery, and this is exactly what I was saying about these guys are not medical fitters. They are just faja people. She got a custom faja made. She couldn't fit into it. It was 2, 3, 4, 5 sizes too small, and she never used it. I told her, keep it, don't get rid of it. We may fit into it one day, because she was really bad. Okay, so we got her into a garment. 2 weeks in, she shrunk the whole size of a garment and was able to get into that garment, which was actually, it was like 2 sizes smaller than the one that she was wearing. Let's say, just for explanation purposes, she was wearing a large. This garment is a small, right? The custom faja is a small. She could never fit into it. After working with me virtually, not even hands-on, virtually following my guidance, she is now in that smaller size, that small instead of the large. We get her in there with the foams, fully stacked. She puts it on. Okay, great. I think she shrunk. It was within a couple days she shrunk, and we were ready for the second hook. She puts it on, and she's getting a stabbing pain in her ribs, and she's like, what is going on? Now, when you guys do virtuals with me, I check in with you. We do a virtual once a week. We do your first initial one, explain to you what's going on, you get your products and stuff, and then you see me again, and we really kick off your post-op care stuff. So I explain everything, how you got into the situation, why you're in there, and what we need to do post-op, and then you get your massages, you start on your recovery path, and then we do once a week check-in virtuals until you feel like you're comfortable and you're good and you don't need me anymore. So I texted her to check in, and I called her right after because she said it was stabbing her. And I was like, what do you mean? She's like, yeah, it's only on one side. And I'm like, okay, well, you do have the fibrosis there, but this has never been a problem before, and you weren't feeling this stabbing before, so it's not the fibrosis, it's the garment. This is the custom faja, right? She said, yes. I said, all right, let's see it in your virtual tomorrow. The garment that they made for her, the inches on this side are taken in smaller than this side. And you can see it in the pictures I'm going to post. She is in the faja. Her body is even. We filled her out with foams evenly, so she's even all the way around, so there's no way that there's any dips or curves in her body. She's got foams lining her 360. She's completely one size all the way around. The faja on this side, they pulled the seam too tight, and it's crushing her ribs. Mind you, not even her stomach. Her bones, her ribs, it's crushing her ribs because they cut it wrong. This is why you need to be careful with custom fajas. This is why you need to do virtuals with me if you have problems like this, because you have no idea what's going on with the faja situation. So, we figured it out. We rigged it. We made it work. To this day, 3 weeks later, 2 weeks later, no, 3 weeks later, because I saw her this morning. 3 weeks later, looking at the garment, she's on the third hook now. Of that small garment, she's like, we've been actually tracking her measurements. Over the past week, she dropped 2 centimeters. And I know that doesn't seem like a lot. We're not measuring around. We're measuring her fibrosis shrunk 2 centimeters. Just from doing the little bit that we've been doing. You can see on there where that one side is digging into her ribs. And the other side is cut into her ribs, but not anywhere near as bad. The faja is creasing into her so bad because it's cut wrong. So that's soon to come. The virtual, the lives that I'm going to do to explain these things and show you these things with the other therapists in the field, my other clients that have been doing virtuals with me to explain this stuff, to explain their experience, so it's not just me talking to you, but you actually hearing what they have to say, being in your position. Those are coming soon. But again, to sum all of this up, fajas should not squeeze the shit out of you, number one. Number two, you should be at the same comfortable compression ratio in your faja. It should feel the same your whole recovery. It shouldn't get tighter. Number three, be careful with custom fajas. They're not always cut right. And number four, where you guys are getting these things from, they are not medical people. They are not medical compression garment certified fitters. They are just people selling fajas. That's it. Even if they're making a custom faja, they are not taking into account BBL, swelling, lymphatic system. So please be careful. And the last thing I'm going to say to sum this up is if you need a garment and you're looking at purchasing one online and it's $120, our garments are $90. That's it. And I designed them myself, and they are lymphatically designed to have, like I talked about in the beginning of the video, that compression gradient ratio where it funnels your swelling, and it's let out in places and taken in places. And the way the panels are designed, I'm going to have a whole video on this. The way the panels are designed are for compression for your lymphatic system, not just compression all the way around. It's designed to compress your lymphatic system so that you're actually helping with lymphatic movement. It's let out in those areas so you don't crush your lymph system, but it's still giving you proper compression post-op. So that video is going to come soon too. But if you need one, we're not selling them online yet because I don't have enough to sell online and just be selling them out there in the world. Set up a virtual with me. Call the office, 732-841-0142. If you need a garment, I can fit you. We can measure you, we can do the whole thing, we can talk about what the hell's going on, and maybe we can even try to use a faja that you have and rig it with the foams so that it's not crushing the crap out of you anymore. Because I do that a lot too for my virtual guys who it's going to take too long for you to receive the garment over shipping. It's going to take like a week and you need something now. Let's see what you have. We'll figure out how to work with it. Let's see what you're using now. We'll rig it so it stops crushing the crap out of you and causing fibrosis just to get you by until we can get you, if we even need to, get you into something that's better. Or maybe we can just work with what you have and make it fit right and properly fit it for you. So call Alex. Everybody knows Alex. Happy Alex. I will do a live with her at some point and introduce you to you guys. 732-841-0142. Alex can get you set up with a virtual. She can explain to you more about the price and what it includes and all that stuff. And I will be doing a lot more videos on the garment thing. Now that I've started on this, there is a whole list of videos I need to do on this to answer all of your questions that I get continuously over and over. So guys, have a great night. I will see you all soon. And that's it.